Hello, from this side is Adam. I'm a medical trainer and mobility coach based in Dubai. Today I would like to show you a few tips whenever if you're gonna find yourself in a comfortable position that you're gonna feel pain in the lower back, how to start working out, how to start moving to feel pain-free and train more smarter to avoid injuries, and as well help you to improve your performance. Foam roller, the one ball for the lacrosse, and the bands. Can be resistance bands or can be a tower. We can start from the position, so we're gonna already target the area where is the most painful, so the lower back. So we want to lie nice and comfortable on the area where is the lower back and look for the tightness. Very important is to place yourself that the upper body is gonna be down on the mat, and we're moving slightly on this area to look for it for the moment. We can add the breathing. Very important is to relax your body, calm down. 5 seconds inhale all the way going up and exhale down. So we want to calm down our body, our system, relax, stress out, and we're moving around the lumbar spine area to be able to find those points. Most we can find a lot of trigger points in that area, that zone. So moving slightly. If you're gonna find yourself that this is very painful, I recommend to use more soft foam roller or place the towel, additional towel here in that area to be able to fully mobilize that area without the pain. Yeah, so control the movement going up and down, moving. We can add also rotation, holding in here our shoulders and moving. Not going with the head down, like up, and pulling our neck. So we have to relax our neck, our shoulders, and only sliding from side to side. That will be very important for us to be able to fully relax. Yeah? Adding the deep breathing, up, down. Inhale by nose and exhale by mouth. Also we can go with the shoulders all the way across, down, and all the way up. Up, down, up, and down. Then I recommend to use, so we can bring our knee to the chest, slightly going 1, 2, 3, and extend all the way. Yes, that will be very crucial in here to be able to mobilize our hips going up and down. 1, 2, 3, all the way to the chest. We can add additional movement in here. We can also work in here with the knee going side to side and open. So 1, 2, 3, 4, 5, 6, and open. Very often we can find those people who are spending a lot of time in a sitting position that the hip and knee is locked in one position. So then we don't spend the time to extend. So that kind of extension is already gonna have a nice feeling for our knee, for our joint in here, for our hip. To extend fully, stretch the hip flexor, mobilize, moving in here, and that is gonna bring us a lot of benefits. That kind of morning or evening before going sleep mobilization. As well, I would recommend whenever you would find yourself in the pain and you want to do the workout, you have to loosen up that tension to don't bring another tension to your body. And we go, moving around, bringing, yes, we can also add additional strength in here. So with the one shoulder, we can press in here the knee down to the hip joint socket to be able to a little bit, yes, compress. That kind of compression plus the movement is gonna help us to mobilize even more, bringing in. So from side to side, listen to your body. That is very important, to listen to your body, that you know that you are not hurting yourself, you are working to loosen up the tension. We need to know very important also is to know the border between the pain and the nice stretching, nice mobilization effort. 1, 2, 3, 4, up. And bringing. So very important in here as well is gonna be here extension and coming through. 1, 2, 3, 4. Other side, same thing. We're gonna go, and then we can also go with the leg across, and we can start moving in and out, pushing. 1, 2, 3, 4, 5. Very control the movement. Very crucial is to don't rush with this one. Very control. Roller is on the lower back supporting our position, and we can increase with every breathing going more. 1, 2, 3, 4, 5. Important, head is facing down on the floor, not hanging in, because we can bring more tension to our head and our neck from that kind of position. So very important in here, relax your shoulders, relax your neck, and then we move it. 1, 2, 3, 4, 5. Next thing what I would recommend to do is find yourself, so we can bring the resistance band, or it can be a towel if we don't. Tie up the leg exactly from that side, going same position. What is going to help us to do it is that we need to bring the feet down, so toes are facing down, heel is up, and from here we're pulling, so we want to pull the knee to the chest and slightly open up. Knee to the chest and open up. We need to remember that we can't fight with this one, pulling strong, because we can hurt in here. If our hamstring is very tight, it's gonna cause us a lot of pain. So we have to be very careful, very easy going at the beginning, trying to bring the toes down, heel up, to be able to work on the ankle mobility, to be able to improve our knee function. So that kind of movement, that kind of mobilization is helping us really improve our lower back area, because all of those muscles are connected. If our hamstring is tight, it's pulling our pelvis to the back. This is what mostly is happening, that kind of structure in here is strongly pulling our pelvis to the back, is disactivating our glutes, and then all that pressure is giving us a lot of pain and discomfort in life. Going through. So as soon as we mobilize this, we're gonna improve our walking, all our system. Yes, how we can work, how we can exercise pain-free. Yes, and also more effective. After that one, we can also add the whole movement here, that we're gonna extend our leg and then flex, pulling in. 1, 2, 3, 4. Extend and all the way pull in. 1, 2, 3, 4, 5. 1, 2, 3, pulling, 4, 5. If we cannot fully extend our knee, it's okay. We can bend it, but a little bit increase the stretch and going back. Now, and next one, we can also bring to this one, we have to control where is our roller position, so we can correct our roller, and then we go to the side. So now we can mobilize our muscle tape in here, from the leg to the hip, going through the hip to the shoulder, going to the side. Yes, we work on this area to be able to increase that kind of stretch, mobilization here, going forward, up, and coming back, and all the way. 1, 2, 3, 4, 5. We should be facing to the shoulder. It's gonna help us to really improve the stretch. That technique, you can feel already in here on this whole area is opening from adductors in here, all through the T-spine and shoulder. And then we can also add in here a nice rotation, so we're working on the hip rotators, those muscles which are responsible for stabilization of our joint. To bring more fluid inside the joint is gonna help us really to improve the joint function. And then we can go all the way to the other side. Moving to the other side and slightly go up. And now we work more for the hip rotators and hip abductors. And also changing shoulder. So this shoulder is pulling now. Other shoulder is here. We look to the other side. Follow up the shoulder. Trying to reach with the shoulder down to the ground. And with the leg as well. Pulling in and out. This time I feel everything. All this muscle tape from the leg is coming through the hip. All the way shoulder and up. And I feel a lot on the nerves in here that I'm simulating in here. And we need to remember that all of these muscles around the hip, they are connected with the lower back. So as soon as I'm gonna loosen up the tension from here, from the hip, from the leg, we're gonna immediately improve our lower back condition. And going forward and back. Now we can add also flexion. So flex the knee, extend, flex the knee and extend, flex the knee and extend. Add the rotation as well. Yes, and moving. That kind of movement here, and with each breathing, we can increase the movement, going more forward, even more. Don't forget about the proper breathing and breathe. If you find yourself difficult to use the band or the towel in that position to be on the roller, you can start at the beginning without. That is gonna be the first step to be able to, is gonna help you even to loosen up the more hamstring in here and improve the knee function. Just going from here lower, so the roller is on the lower back, we hold the knee from the other side, from the back, and we're pulling the knee to the chest and extending, yeah? Pulling and extending. 1, 2, 3. Pulling and extending. Pulling and extending. At the beginning, very soft, very easy. With every movement, we can increase, going more and more. Oh, if you want to even challenge yourself, if you are more flexible, you can hold in here for the toes and going forth and back, to be able to hold and extend, yes? And then also you can try to open up in here the leg and go, open up and go. You don't need to even straight totally full, but try to just open up, going around, doing the circle. That kind of therapy with the movement is gonna help you to improve in here the hip. It's gonna improve in here the knee function to be able to extend fully and going back. And then we can do other sides as well. Yeah, so here, going through, 1, 2, 3, 4, 5, pushing, extending, going around, one side, other side, and back. From this mobilization, what we need to remember is that lower back is just can be only the one of the reasons why we have a pain and problem in our body. That all of this structure has to be mobile to be able to bring release in our body. So if we're gonna only treat the lower back, we're not gonna solve the problem fully. So to be able to solve, we need to work globally, holistic way of thinking, to care of our body as a whole piece, as a one unit. Thank you.